Welcome to the Soul Grit Podcast. I'm Ann Taylor McNeese, and I'm a licensed marriage and family therapist. I also love Jesus, and I'm passionate about all things gospel and therapy. I created Soul Grit to be at the intersection of mental health and Christian faith. Christ followers need a place to ask questions and get answers about mental health. Join me as we dive into real stories and real questions from people who want to honor God with their hearts, souls, and minds. Hi, welcome back to the Soul Grit Podcast. This is Ann. I'm here today with Chad Potts. Hi, Chad.
Hello, how are you?
Good. I'm so glad to have you here because I think we're going to have a great conversation. Chad is a pharmacist and he's also a pastor and recently entered the world of podcasting with the RevRx podcast. So I encourage you guys to go check that out. We'll talk more about that later. But just to get to know you a little bit, Chad, did you become a pharmacist first or a pastor first?
I get that question a lot, actually.
I bet.
It would have been easier if things have happened the other way around. But
Okay.
I was actually a pharmacist first. I graduated from pharmacy school. I graduated with a ton of student debt, student loan debt.
Mhm.
And here I am working my first job, trying to pay that down and start to feel a call on my life to ministry. And I'm thinking, God, you've got a really good sense of humor. Where was this, a few years ago before I committed, $200,000 towards becoming a pharmacist? And, God has this way of doing things that make us say, what are you doing?
Mhm.
Where's all this headed? But he always has a way of working it out. Things always happen according to his plan, and it's always perfect.
Mhm.
And long story short, ended up being exactly what it needed to be. Because with my background in pharmacy, I'm able to speak to people in a way where, I understand the processes that happen in the body.
Mhm.
I understand on a molecular basis the things that go on, the medications people take. And so you'd be surprised inside the church as a pastor, and I'm working as a young adult pastor currently, so that 18 to 30-year-old age group.
Right.
But I get hit all the time with drug questions inside the church. And, they wouldn't take those to just a typical pastor.
Yeah.
But it's really kind of opened me up to be able to help people in a lot of different ways. I can help you from the spiritual perspective, but then, I can also see things in a physical and in a medical standpoint. And I can kind of see the intersection of those things because they're not all that separate.
Yeah.
We tend to think of things, in the spiritual realm as only spiritual. And we think of things in the physical realm as only physical. But, with my perspective, seeing things from both sides, I see how interconnected things are.
Yeah.
And God's able to use that in a lot of cool ways. And the latest way that he's able to use that is both with my coaching business, where I combine my knowledge as a pharmacist and as a pastor. And I help come alongside men and just really help them thrive in all areas of life.
Nice.
And then with my podcast, which is for general audiences, not just men, be able to pull together, like I said, body, mind, and soul, and show people what it looks like to really live out God's best for your life. And
Right.
so, I was a pharmacist first. And, if I had picked my life my way, I would have known about this calling from God way before then. And things would have worked out, perhaps in my mind, a little more smoothly.
Yeah.
But, smooth's not always best. And,
Right.
and it's in those times that God really builds our faith.
Yeah. Well, this makes you a perfect guest for the Soul Grit podcast because we talk a lot about the intersection here of these different realms of our life. It's not just psychology as the world does it. It's not just spirituality as the church does it. It's all of these together. And the older I get, the more interested in the body I become as well. Like my
Sure.
listeners will know, I'm very interested in functional medicine, integrative health, and
Yeah.
I'm also a group fitness instructor. And so these all come together. We can't just do one silo, right? We have to do them all
Right.
together. So today, because I have you here and you have this particular expertise, I know you're coming from like a gospel-centered lens when we talk about the body or about medications or life in general. And so I want you to be able to talk to us about this this area of our health that maybe somebody else with a different perspective wouldn't really be able to give such a integrated, holistic perspective. So today I want you to talk to us about medications because a lot of us are either using medications primarily for just those commonplace mental disorders like depression and anxiety, or some of us might have to be on mood stabilizers for bipolar, or we may be taking antipsychotics because of certain things. So I want to just talk a little bit about those general, like the classes of what we call psychotropic medications. This means it's a medication that helps you with your mental health, right? And so
Right.
as a pharmacist, what would be the most common kinds of medications that you see prescribed for people having mental health struggles?
Yeah, sure. Hands down, it's going to be depression and anxiety medications. Those are by far the most common. And though a large portion of those, they're antidepressants,
Hmm.
and they work in the brain on your serotonin.
Hmm.
And so I think a good place to start and kind of thinking about how do we categorize these things are which chemicals in the brains do they work? Which chemicals in the brain do they work on? So thinking about, all right, so there's neurotransmitters in the
Right.
brain, and those are the chemicals that kind of allow our nerves to speak to one another. So they can carry a message, activate the next nerve, or they can slow down the message and keep it from activating the next nerve, and modulate kind of how all that happens. But serotonin is kind of our happy neurotransmitter.
Hmm.
Depression has been linked to not enough serotonin activity in the brain, and really, kind of thinking about how those work. Well, if serotonin is linked with happiness, if serotonin is linked with things like calm, and serotonin can actually be it goes into the sleep cycle. It plays a role in our sexuality, in our appetite. Really, serotonin is a very broad neurotransmitter. Um, so when we're thinking about, all right, if we want to boost this, if we want to boost the serotonin activity in our brain to combat anxiety, to combat depression, then you really got to think, all right, well, you can't in isolation do that
Yeah.
without affecting some of these other things.
Right.
Um, and so, but hands down, it's these SSRIs. You probably heard it, selective serotonin reuptake inhibitors.
Hmm.
Those are the most common class of medications that we see in the medical field for really any kind of mental health disorder.
Yeah.
Many of them are used for depression, generalized anxiety disorder, panic attacks, that kind of thing.
Mhm.
Um, and really, that's kind of the place where people get started. If you go into the doctor and you tell them that you're struggling with depression, you're struggling with motivation, you can't really get going, and there, of course, there's a litany of questions that they ask to kind of help determine if you actually have clinical depression or not, or clinical anxiety.
Mhm.
That's where you're going to start, is with this class of medications that increases the serotonin activity in your brain.
Mhm. Would you mind mentioning just a few of the names of these drugs so people
Yeah.
can say, "Oh yeah, that's what I take."
Yeah, sure, sure. So there's two, when we're thinking about medication, there's two different ways we can mention them. There's the brand name, and then there's the generic name. So the brand name are things like Lexapro, Zoloft,
Mhm.
Celexa, those sort of things. But then your generic name is going to be the chemical name, and
Mhm.
that might be the name that's actually on your bottle, because a lot of these are available generically now.
Mhm.
So you've got Zoloft, which is sertraline.
Mhm.
So that may be what's on your prescription
Probably the
bottle.
most common that people start out with.
Yep, yep. Lexapro, which is escitalopram,
Mhm.
and then Celexa, which is citalopram. And you can see a lot of those sound similarly. They're based on a similar chemical structure. There's Wellbutrin, which is bupropion. There's tons of different ones.
Mhm.
Those are some of the most common ones. But one of the things I like to tell people is, people are started on a medication for depression or anxiety,
Mhm.
and they start having side effects.
Yeah.
And then they say, well, I can't tolerate antidepressants.
Mhm.
And so one of the things I like to tell people is, well, no, there are a lot of different ones, and each one affects people very specifically, very individually.
Yeah.
So, lots of people start off on, say, Zoloft,
Mhm.
and they titrate the dose. You always start at a low dose and go up higher.
Mhm.
And as they're titrating it, they start having some adverse effects. So whether that be, stomach effects, whether that be a big one we see that people don't really like to talk about, is like decreased libido.
Yeah.
That's one of the big major side effects of these. Some make you sleepy.
Hmm.
Some make you more activated.
Hmm.
Some decrease your appetite, so make you, almost not feel like eating, maybe lose a little weight. Some increase your appetite and make you possibly gain some weight. And so, because there's so many different factors there, and no two people are alike, tell your doctor. Have that conversation. It's not like if you fail one, you failed them all.
Hmm.
There's a lot of people are kind of lost in that. Like, well, I guess I just have to put up with this. This is what
Right.
it's going to take. To which I would say, not at all. There are so many different options that you can come off the one, start another one, and
Hmm.
you can get your life back. I've talked to so many people who, you really can just really start to see what it looks like to live again,
Yeah.
because you've been just kind of getting by with the side effects, and well, I guess that's what it takes to not be
Hmm.
as anxious. Well, no, we can
We
usually
can
find
tweak it.
something that works for you. So
Yeah. I have that same encouragement to people because sometimes in my practice, I'll see somebody who's just not getting the traction that they need just by talk therapy alone.
right,
So they need to have that little bit of biological support. And so
right,
I'll say, let's start considering what it might be like for you to try an antidepressant or
right,
anti-anxiety. And you're going to go to your doctor and you're going to, present this case. I've been in therapy for this long and I'm not seeing the results that I need and I want to try something. And a lot of times people will have those same fears that you're talking about, like,
hmm
oh, well, no, I don't want to take the chance of gaining weight, or
right,
I can't do it because it gave me diarrhea, or I don't want to,
yeah,
which is
right.
good. Like you shouldn't have to go around having diarrhea, you know.
But you'd be
Um,
surprised how many people are like, well,
yeah,
just the
that's just
price
what
you
it
pay, right?
is. Yeah. And so I think one of the things that a lot of people don't realize is like maybe when this field started out, we had what, like lithium, Valium, electroshock therapy, and lobotomies,
Yeah,
right?
right.
And we're not, I mean, some of those things are still in working, but that's not what we're dealing with now. There are literally hundreds of
Yeah,
variations of these chemical processes and dosages and different ways to take them that
yep,
we can find the one that's right for you.
yeah,
I think, Chad, sometimes where people need the encouragement is if they've tried a few and they haven't gotten the results that they needed or the side effects were too unbearable, they feel discouraged. Like this
sure,
isn't gonna, I can't just keep being a science experiment for my
right,
doctor, you know?
right.
Yeah.
Yeah, and at that point, it does become a little more difficult to treat.
Yeah.
But it doesn't mean that there's not hope. It doesn't mean that it's not treatable. There are different things that can be added in combination, and to some degree, yeah. I mean, you're going to feel like it's trial and error.
Mhm.
Um, but it's not your doctor doing that deliberately. It's just
Right.
sometimes that's just how it works. Everybody reacts differently to the medications, and there's really no way of telling, how you're going to respond to it.
Yeah.
There's really until you try it.
Yeah.
And a lot of times a trial of one of these is going to be a couple months. It's
Hmm.
not like you can tell in a week that hey, this is going to work for me or this is not going to work for me.
Hmm.
And so it can take years sometimes to really find the right thing to work for you. But I would encourage you to, keep trying because it's worth it. Once you find the product that, that helps with you, and we'll talk about some other things too. But once you find the medication that works for you, I mean, it's like a light switch. Things are so much better.
Hmm.
But then there's always some other things that can be done as well, that are not drug therapy, that you might can start implementing into. And of course, what you're doing is a big part of that as well.
Right. Yeah, I think that sometimes people well, let's just say this about side effects. Often you'll know right away, right?
Well,
You'll
that's
know
true.
right
Yeah,
away if you're
yeah,
having side effects. And
yeah.
sometimes those things resolve within a week or two and you're able to get the therapeutic dose without
Hmm.
having those terrible things happening. But sometimes you don't know if the thing is working for
Right,
the first month. And so
right.
you kind of have to hang in there through the hard part to get to the good part, which is
Yeah,
true of life in general and therapy in particular. You
yeah,
know?
absolutely. The
Yeah.
beginning's always the hardest, and
Yeah.
it's kind of that perseverance. But yeah, an adequate trial of an SSRI, for example, is 4 to 6 weeks.
Mhm.
really until you've tried it for that long, you're really not sure that it's gonna, that it's gonna work for you or not. And then, there are dosages that we can bump. Of course, the risk of side effects goes up as well. But yeah, that was a good delineation. You'll usually be able to tell initially, and then at the dosage increases pretty immediately if you're going to have side effects.
Yeah.
But yeah, it's the efficacy. How well is this going to work for me? That can sometimes take a while because you're affecting those neurotransmitters.
Mm-hmm.
And that doesn't just change overnight. It's something that takes some time, and the body adapts and the body changes, but it's not going to be a quick fix.
Right. Right. Have there been any new medications in the mental health realm that you've been particularly excited about?
Um, there are some that more in the line of antipsychotics,
Yeah.
so less
What
in
are
the
you
line of
seeing there?
antidepressants. Yeah. Um, the issue with antipsychotics. So when we're thinking about the comparison between your antidepressants, your antipsychotics, we're talking about a different neurotransmitter now. We're talking about a different chemical.
Mhm.
With depression and anxiety, you're generally targeting serotonin, like I said. With antipsychotics, you're treating a different disease state. You're treating schizophrenia, you're treating bipolar, particularly that mania aspect of bipolar. And you start targeting dopamine more than you target like serotonin. Now, early on, you mentioned lithium. Lithium's a mood stabilizer. You'd mentioned Valium. So Valium's a benzodiazepine. So that's more for the anxiety type of things. And we can talk about that class too. But when we think about antipsychotics, all right, now we're getting into, there are some old meds that really aren't used anymore because I call them dirty drugs.
Yeah.
They were dirty drugs because they didn't just work on dopamine.
Right.
They worked on like several neurotransmitters. And the more you hit at one time, the more side effects you're going to have.
Right.
And so, used to with some of these medications, I mean, you would just have horrible side effects. You would have side effects with like heart arrhythmias. You would have blood cell counts that you would have to monitor. That's still the case with one or two. But by and large, the field of antipsychotics are really getting better and better because what they're doing is they're getting more selective for the parts of the brain and the dopamine receptors that are most associated with mental health. And one of the things I want to say is that serotonin is not just in the brain. Serotonin is in a lot of different places.
Yeah.
Dopamine doesn't just affect the brain. Dopamine affects your entire body.
Yeah.
For example, one of the illustrations I like to use is when we're thinking about dopamine. If you have too much dopamine activity, then that's where you find some of these. You find psychosis, you find schizophrenia, you find bipolar mania. That's associated with too much dopamine activity. But if you don't have enough, then that's associated with Parkinson's disease and movement disorders. So you can see right there that it doesn't just affect your mood and it doesn't just affect your behaviors, but it affects your movement. It affects all over. And so in the field of antipsychotics, the newer agents are going to be more selective.
Okay.
They're going to work more in the areas of the brain that are associated with these mental health disorders, and they're going to have less side effects because of that. And that's really that's the goal, right? We want to fix the problem without creating another one.
Right. That's
and so the selectivity of some of these are a little more positive. And so, we're starting to see some advancements there, and really have been for years. But it's just like with every new one that comes out, it's like, all right, well, that one's a little bit better, and that one's a little bit better. So you're seeing incremental changes. Another thing is, one of the things that we find a lot in mental health patients is, you start to feel better on your medications, and then you start to think, well, I don't think I need my meds anymore.
Right.
Because I'm better. It's fixed me. Right.
Yeah. I particularly see this with bipolar patients.
Correct. Right. Okay. And so they're like, I don't need this anymore. And so then they quit taking their medications. And one of the advancements that we've seen are some injections that are available now with some antipsychotics that last for long periods of time. So, sometimes even a month. So instead of having to take a pill every day, you just take a shot every month. And that's a lot better tolerated than having to remember to take something every day. And then this issue of constantly like, well, do I really need this? And,
Now you just have to fight about getting that person into the appointment for the shot.
yeah, yeah. So there's still a battle to be fought. It's just a different one.
Is that administered at a pharmacy or at a clinic?
It's usually at a clinic. Yeah.
Okay.
Yeah.
Good
But
to know.
we're starting
Yeah,
to
I
see
haven't done that yet.
some of that that's coming out and becoming available. So
Yeah.
making some strides. And I really think the biggest strides that we're seeing in mental health are on the sides of these conversations that we're having that's normalizing it's okay to not be okay.
Right.
There's always been this stigma, it seems like, of, if you ask for help or if you say you're not okay, then somehow you're admitting weakness. Somehow that's, and even in the church world, we talked about this a little bit, but in the church world, it's like, okay, you must have a lack of faith. And that's not at all the case. And I think the more we can have conversations like this and more we can say, there are solutions to this. You don't have to live this way. This is not something you have to be ashamed of. Go ahead and reach out, make an appointment with your doctor, see what options are available, or, implement some of the things we're going to talk about that are non-drug therapy. Find a therapist, lots of things you can do. But really making it okay to do so, I think, is some of the biggest strides that we're making on the side of mental health.
Right. Which is why people like you and I are having these conversations and publishing them over the internet, is because we want people to know that it's okay to have therapists and Jesus and a pharmacist. Right?
Amen. Amen.
Yeah. Because some of these things are going to make you more effective as a leader, as a husband or wife, as a parent, in your job. Like you're not as effective as you could be for the kingdom of God if you're not addressing all the aspects of your health, from physical to spiritual to mental, all of that.
100%, 100%. And and that's the interesting thing about where my worlds collide is that I see that, and it pains me. I had a guy at church that was talking to me about his anxiety, and he's like, I hate it, but I take medicine for it. And I'm like, that's okay, buddy. Me too.
Like, what do you hate so much about it?
He was like, what? And I'm like, hey, man, listen, we know now, we may not have known this 50 years ago, but we know now that depression, anxiety, it's a disease. It's an imbalance of chemicals, hormones, which is not a whole lot different than something like diabetes, which is a deficiency in insulin, which is a hormone. So would you not take your insulin because of the stigma associated? We've got to get outside of that.
I think like diabetes is probably the best thing to compare it to, because like we have type 1, type 2, right? Like type 1, you were born with it, or it was genetic, it was in your family. Type 2, you developed because of lifestyle choices, right?
Yeah, largely.
And this is true of depression and anxiety as well. Some of us just have this brain chemistry, or we just have this anatomy. It's been in our family all these years, and that's just how our brain works. We don't communicate that serotonin or that dopamine or whatever. Like the neurons are not firing in that way.
Right.
But that's not to say that there aren't some lifestyle things that have contributed, or maybe there's trauma, or maybe we haven't dealt with stress, or there's things that have contributed to us developing a mental health disorder like anxiety or depression. But it's the same, like whether you had type 1 or type 2 diabetes, you need help to get through that. And maybe if you get it under control with some medication, you're now going to be more able to activate some of those lifestyle changes that would end up resulting in less medication, or possibly not needing it in the case of type 2. So I think, that's a really good metaphor that we can give people. If in the church we can say, yes, I want diabetics to have insulin, and, like then we can say, I want people who struggle with depression and anxiety to also have the chemicals that they need so their brains can function appropriately.
And that's a really good way to word that. The chemicals that they need. It's not, a lot of times there's nothing you can do to change your neurotransmitters. Like you can't, think, you can't meditate enough and change. Not that there's not value in that, but at some point you may just have to say, you know what, I need help, and
Mhm.
that's okay. Get help. I
Yeah.
want, like you said, I want my diabetics to have insulin,
Yeah.
and I want those that struggle with mental health to be able to have the resources they need to thrive
Mhm.
as well. So,
So I don't know about you. Like once in a while, if I get a new medication, I'll have a conversation with the pharmacist. But I know part of your job is consulting and advising patients on new meds, right?
right,
But
right.
I'm guessing you might have more conversations in your pastoral role than you do in your clinical role, right?
Yeah, it's not always as separated as we might think.
Oh yeah.
Um, and for example, one of the things I do in my role as a pharmacist is I do make some home visits, and I go out and see
Oh,
patients who can't come to our clinic. I go see them, and
is
within
this
that
a
home,
Georgia thing? Because I don't know if we have this in California.
yeah, yeah, and it's kind of a unique program. I'll tell you more about it
That's cool. Okay.
kind of as we go,
Go ahead.
but yeah, so in the home, I'm here with these people and I'm teaching them about diabetes or whatever the case
Mhm.
is, and you can't help but pick up that there's other needs there.
Oh yeah.
For example, I went to someone's home and I was talking to them about their insulin and some of the different things that were going on with their health care. And they stopped me and were like, "Well, can I just ask you a question?" I'm
Mhm.
like, "Sure." And they said, "All right, I know you're a pastor." And I'm
Yeah.
like, "Okay, yeah." I mean, I don't, hey, I'm a pastor, but they
Yeah.
knew that about me somehow.
Okay.
But, and then they said, and this was a heavy thing. They said, my son killed himself
Mm,
a few months ago,
mm.
and can you just pray for us?
Wow.
Um, and it's powerful being able to you know get into someone's life through a medical avenue, but then be able to meet some spiritual needs at the same time.
Uh-huh.
It's there's a lot of overlap, but yeah, in within the church, people are always coming up to me, hey, talk to me about this medicine,
Mhm.
or what are some things, and it's always a pleasure to do so because really, when you think about it, pastoral care is care for the whole person.
Yes.
Um, it's not just meeting their spiritual needs and forgetting the rest.
Right.
When you're taking care of the person as a whole, then you're taking into consideration body, mind, and soul,
Right.
and so it's very much a part of that.
Right. Okay. Well, what I was thinking was that a lot of times what I find in my role as a therapist is that the primary physician or the psychiatrist that has prescribed the medication doesn't always have the time or doesn't always take the time to really talk to the person, the patient about how it's working in their body, what they
Sure.
can expect, like what the mechanism is, you know?
Yep.
And so I assume like you get to talk to people about that and I get to
Hmm.
talk about that with people. So
Yeah.
has that uh, like do you see the light bulb coming on sometimes in those
Yeah.
conversations?
So I'm a why guy.
Okay.
um, yeah, I have pharmacy residents that work with me, and so I'm teaching them along the way, and I'm kind of I feel like I get this. Kind of get this notion that, all right, yeah, he's going to ask you why about everything. So, hey, this drug does this. Why? I
Yeah.
want you to understand the why behind it, and you not just memorize a bunch of facts.
Yeah.
But yeah, when we understand why, to
Mhm.
me that really helps us understand what's going on.
Yeah.
We can regurgitate what the doctor said. He
Mhm.
said he's going to put me on this medicine for this, but why?
Yeah.
Why is this medicine a good choice for what's going on in your body?
Mhm.
And one good way to think about it is this. All right, so you have a disease and you have a drug.
Mhm.
What goes wrong in the body with the disease? And then what is the role of the drug in repairing that?
Mhm.
And when you really explain that to people, and we talked about that, a little bit with the neurotransmitters, and then with
Mhm. Mhm.
with insulin and different things with diabetes. But when you really start explaining that to people, the light bulb comes on, and it keeps people educated about their body.
Mhm.
Um, and that's not a knock on the providers. That's not a knock on the physicians and the psychiatrists. The model they have is they're trying to see, you know, tons and tons of patients in a very
Right.
short amount of time.
Yeah.
Um,
It's a
pharmacists are
problem with managed care, not with the
yeah,
particular physician. Yeah.
exactly. It's a system issue. It's not
Yeah.
um, but pharmacists are the most accessible
Yes.
healthcare provider. You can walk in any pharmacy, talk to a pharmacist. You can call any pharmacy, talk to a pharmacist. And so, a lot of times we play that role, and, it's our job when we're dispensing it to counsel, especially if it's a new medication. I mean, that's something that we really need to be doing with every patient. And so helping them understand, what is this drug doing in my body? How is it fixing what's wrong, for lack of a better term. I don't like to use that word wrong necessarily, but, that's our bodies.
Yep.
And then what can you expect because of that? And a lot of times the side effects can be anticipated because of how the drug works. For example, if you're giving insulin to treat high blood sugar, then the side effect of that is going to be low blood sugar. Very simplistic, taking it to mental health. All right. So if you're decreasing dopamine activity in the brain with an antipsychotic, then one of the anticipated effects might be a movement disorder, because we know that that's associated with low dopamine. So, being able to just help people put two and two together, so to speak, really is helpful. One of the things I love to encourage people to do is to be their own advocate in their healthcare. Too many people, and this isn't from a place of judgment or shame or anything like that, but a lot of times it's just, all right, we go to the doctor and what he said I'm going to do, because he's the doctor and I'm the patient and he knows better than I do. All right. Well, I'm trying to move people, and it's not just me. There's a movement today trying to move people into becoming more involved in your own healthcare. Right. Your body better than your doctor knows your body.
Right.
He might know, the medical knowledge behind it, but how it feels. And only how it feels. If something's working, if something's not working. And so being able to have those conversations and say, hey, this isn't working. What other options can we do? Right. But I think a lot of times we're scared because we don't want to come across as questioning. We don't want to come across as disrespectful or whatever the case may be. So we just kind of, we're stuck in that they're the expert, I'm not. But, really partnering together with a team. So the team being your physician, your psychiatrist, your psychologist, your therapist, your pharmacist, whatever that looks like for you, partnering together with them to find the best solution for you is really the way to go. And so, trying to get away from this model where you've got experts and non-experts, because you are the expert in your body. Right. And I want to empower people to be able to speak up and say, hey, what else can we do?
Yeah, I think you're right that the tide is changing in that. Like, I hear more from older generations of, like, I can't question the doctor. They're the expert,
Right.
Whereas I hear more from younger people, this sometimes in a jaded way of, like, they don't know what they're talking about. And sometimes they don't because they haven't been trained in the particular thing that you need help with. But I like what you're saying about, understanding your body. You're doing your own experiments. So, like, if I eat dairy, what happens? If I don't eat, like, when I have sugar, this happens to my body. Okay. So we're doing our own experiments just on that very basic level, but that applies to however complex the disorder gets, right? With your medications and how much you rest and how much you exercise and what other things you're doing to treat the disorders.
And that's the thing too. The more we understand about our bodies, the more we understand about the disease state that we have, the medicines we're taking, we kind of take ownership at that point. And then we start to say, okay, what else can I do to optimize my health? What else can I do besides taking a pill, or multiple pills, to make myself as healthy as possible? What can I do to set myself up to succeed, instead of just, because a lot of times taking medicine can be a crutch for some people. It can be a situation where, all right, I don't have to watch what I eat or exercise because I'm taking a pill for that. And while medication has a role, and yes, I'm a pharmacist, I understand that. It may sound weird coming from me, but to me, medication in a lot of cases should be last resort. There are other things other than just taking another pill that we can do to, to try to get us back on track. Thinking in the mental health realm, CBT, cognitive behavioral therapy.
Mm-hmm.
Find a therapist, find a good therapist that can walk you through, okay, well, let me see how far I can get you. And then, like you said, if you're not getting the traction that you need, then we can refer you and say you might need medicine.
Exactly. Yeah.
But and not just in the mental health world, but just in general, we're so quick to jump to medication.
Mm-hmm.
And I just, we lived in an overprescribed culture. There's a concept called polypharmacy.
Mm-hmm.
That is one of the things that I look out for in every patient that I see.
Yeah.
And there's different definitions of it. The one I like to go by is if you're taking more than 9 medications or
Nine?
nine or more
Oh my
medications,
gosh.
that's
I was
considered.
thinking like three, but
Yeah.
okay,
So
nine.
the technical definition is not. Can you imagine? All right, now I've got 10. I'm technically in polypharmacy. No, polypharmacy to me is like two or more.
Yeah. Okay. So we're
If
on the same page with that
yeah,
because I'm
yeah,
I'm
yeah,
noticing like obviously the older you get and the more difficulties your body is having, the more you're going to have more medications coming in, whether
yeah,
that's, everybody's taking something for blood pressure, for cholesterol, for their mood, for,
yep,
like we're all like as a society, you get into your 40s and 50s and you're going to be on those medications. That's
right,
just how we do it, right? But so then if you add in some other disorders that you might be having in your body, then now you're taking a handful of pills morning, noon, and night, right?
exactly. And the problem with that is that number one, medication effects are additive.
Right.
So you've got a couple of medications and they're for different things.
Hmm.
But what you don't realize is that they can have similar effects in the body, and those can add on to each other. And now you've doubled the chance of you having a side effect. Um,
Hmm.
and we see there's something called the prescribing cascade, and we see this a good bit.
Yep.
So, for example, I'm just going to throw some drugs out there, but for example, you've got a bum hip, and you
Hmm.
start taking ibuprofen, um, anti-inflammatory, over the counter, no big deal, right?
Pretty basic.
Yeah, yeah. Well, what we know about ibuprofen and really all drugs like that are that they can cause you to retain water. They can cause you to retain fluid. And so a lot of times what happens is your blood pressure goes up.
Hmm.
All right. So now you're having your physical. Oh, Mr. Jones, your blood pressure's high. We're going to start you on this blood pressure pill.
Hmm.
All right. So now you're on ibuprofen. You're on a blood pressure medicine.
Right.
And all right, so he puts you on a medication, and it's a safe medication. But one of the side effects is that it can cause swelling in your extremities.
Hmm.
All right, so go back to the doctor. Hey, I think I've got swelling in my extremities. Now you've got a whole set of tests they've got to do. Now, is your heart failing? Is what's the issue? Got Dopplers going on, and lots of costs associated with that. Lots of tests. They decide everything looks good, so they're going to put you on a diuretic, Lasix or something that's going to bring that fluid off. Well, now because they've now you're on ibuprofen and a blood pressure medication, and now you're on Lasix. And one of the things about Lasix is it can cause you to have low potassium.
Hmm.
And so now you're getting some lab work, and your doctor says, "Well, you're low on potassium. Here's you some potassium supplement." So you start taking the potassium supplement.
Hmm.
And so now you're on 4 medications, all because you had a bum hip. and then the high potassium causes you to have some heart arrhythmias. So then you start going to cardiologists because you're having some heart. It's an endless cycle, and
Right.
that's a little bit in jest, but it's so common.
Right. Yeah.
It's so common.
We all know people with this situation.
Yeah, yeah, and if you're not able to kind of put all those things together
Hmm.
and say, "Huh, what was the original issue?"
Right. Can't even
um,
remember now that it was just my hip that was hurting. Right.
Right, right. So, so there's a real danger in that, and that's the reason why I say maybe don't jump straight to medication.
Yeah.
Um, and especially a lot of your newer physicians, but a lot of physicians are looking out for that sort of thing. But within the time constraints they have 15 minutes to see you,
Hmm.
to work up every bit of you, all your medications, all of your disease states, all of your labs, look up all that, have a conversation with you. You want to tell them about how your granddaughter went to prom last week, and all this stuff. Um, things fall between the cracks, and it's never anybody's fault. Nobody's trying to do that,
Hmm.
but the system kind of sets us up to do that.
Mm-hmm.
And so being your own advocate, doing your own research, using that team approach, like what we talked about,
Mm-hmm.
really helps minimize a lot of that, and really kind of keeps you off of that whole cascade of systems that can go wrong.
Yeah, for sure. So we've alluded to it a little bit about there are some other things that you can do to maybe not have medication be as big a part of your life. Now,
Sure.
let's just reiterate, you and I both believe that there are times when medication is the thing that you need.
Yeah.
And we're thankful that there's people like Chad out there who with an eye on the Bible and on Jesus, he's helping to care for people through this expertise that he has in the area of pharmacy. Okay, so that's out there, just so you guys know.
Right.
There are people at your pharmacy window that you can talk to about some of these things. And I love
Sure.
that you brought up that the pharmacist is the most accessible healthcare worker. Like, I never
Mhm.
thought about that before, but you're absolutely right. I can walk into my Target. That's where I get my pharmacy. I can walk into my Target. I know the pharmacist. His name is Kevin. I know that if I ask to speak to him, he'll walk over to that window and I'll be able to speak to him right then. So
Yep.
that's a really good point that you brought up. Um, so with that being said, what are some of the things, maybe this is more in your pastoral role or your role as a health coach, like what are we doing so that people don't have to rely so much on medications?
Yeah, sure. A lot of it is just holistic thinking,
Yeah.
holistic health. All right. So, what can I do to be as healthy as possible? Um, Spirituality does play a role there.
Mm-hmm.
I've talked. Let me explain that with an illustration.
Okay.
There have been some people who I've known, and I've heard stories after stories of, I just didn't have a peace.
Yeah.
I just didn't have a peace. That could be misconstrued as anxiety. That could be misconstrued as even depression.
Mm-hmm.
Um, what they were describing for me was a period where they were outside of the will of God, and likely knowingly, outside the will of God,
Mm-hmm.
living life that was not what God wanted for them, and they knew it, and they just didn't have a peace about it. All
Mm-hmm.
right, so can spirituality, or some facet of that, lead to some of these symptoms? Sure.
Mm-hmm.
But is there a thing as clinical depression and clinical anxiety that has nothing to do with spirituality?
Mm-hmm.
Absolutely.
Mm-hmm.
I
Yeah.
want to make that distinction, right?
Yeah.
If you have anxiety and depression, it doesn't mean you're not praying enough.
Right.
It doesn't mean that your relationship with God is not good enough.
Right.
It doesn't mean you're less of a Christian. I just want to say that as clearly as I can, from a pastor and from a pharmacist. That's not what that means.
Yeah.
It is. It's separate. But
Yeah.
can there be some overlap? Sure. All
Yeah.
right. So I want to talk about that first. Pray. Ask God to show you, hey, is how I'm feeling in any way related to my faith?
Mm-hmm.
And He'll let you know. You'll be able to put a finger on it. Talk to a pastor.
Mm-hmm.
Talk to a counselor, Christian counselor, something like that. You'll be able to put your finger on it.
Mm-hmm.
Most of the time, that's not the case, but I'm just saying it can happen.
Yeah. And let
So
me also
that's
interject right here that I think probably both of us also believe that God still does miracles and
mhm.
that if he wanted to heal you miraculously of your depression or anxiety, he absolutely could.
Yes.
But we also believe that that's not the means he always chooses.
Yep.
And so he's provided this common grace of medicine
Yep.
and of lifestyle changes and community support and spiritual support. All of these things go into healing, and it's no less a miracle if God does it in a process over time than if he just, snapped his fingers and
Mhm.
made you well.
Right. And I think of it this way: God heals in two ways. He heals with a supernatural touch, or He heals through modern medicine. So either way, if you're healed, that's great,
Yeah.
right?
Right.
And then I guess if you think about it, there's a third way. He heals on the other side.
Right. In time,
um,
in
you know,
eternity. Right.
yeah, right. But yeah, that's a really good point to bring up. He can 100% you work miracles.
Yeah.
Can He cure your anxiety, depression? Sure.
Yep.
Does He commonly do that? No.
Yeah.
Um, doesn't limit his
That's
power.
not what you and I see in
Hmm.
practice, even though we're both sold out for Jesus.
Absolutely.
We
Yeah.
believe he can.
So realize, you're not in the minority there if you're still suffering from this. But I just want to be clear about that.
Yeah.
So that's kind of I think about it in body, mind, and soul. All
Mm-hmm.
right. So that's the soul component. Um, and then thinking about body, because they all go together. It's hard to have a healthy mind if you have an unhealthy body, and other way around to a degree. But thinking about the ways that this goes together. So one of the things, so I've got kids that are 3, 5, and 7.
Mm-hmm.
So I'm not far removed from that newborn
Yeah.
stage, right? I don't remember a lot of it.
Yeah. Same.
Yeah, and it felt like we were there for about 5 years, because of the stair steps. You're similar.
Yep. Mm-hmm.
And one thing I know is that sleep greatly affects your mood. um, can I say that again? Sleep greatly affects your mood.
Right.
Sleep affects your ability to handle stressful situations. Sleep affects your ability to think critically, to problem solve. So, if you're feeling like things are off, that may be something to take attention, or to, kind of take stock of.
Yeah.
How am I sleeping?
Yeah.
And you can go deep into this too, but, essentially you can Google sleep hygiene.
Yeah.
and,
It's pretty simple.
and there's some very, very practical tips that you can take to ensure that you're setting yourself up to sleep well.
Right.
But if you've been through that stage of parenthood where like you're not sleeping well, you know what it's like to be sleep deprived.
Mm-hmm.
And the biggest thing for me and my wife was that everything was a big deal when we were sleep deprived. It's like, it was something little that normally we could just work past.
Yeah.
We'd make, mountains out of molehills,
right.
from,
Your
so the saying goes. Yeah. And can you see some similarities with some mental health disorders?
Mm-hmm.
Sure. So that's one place to kind of think about. Another thing is nutrition. I think that's worth mentioning.
For sure.
What are we feeding our bodies? What are we putting into our bodies? Because a lot of what we eat affects those neurotransmitters.
Right.
Also, there's this concept that the gut is called the second brain. And I mentioned to you a lot of times there's serotonin in the brain, right? There's serotonin in your gut. They talk to one another, and so when the food that you're eating is not nourishing your body, when things are out of balance, when you're eating a lot of fast food, eating a lot of junk food, things that our bodies were not created to eat a lot of, then you might find that some of these symptoms are exacerbated. And then there's this whole exercise and movement thing. There's a reason. So just today, came into work, and my Monday went like not at all like I thought it was going to this morning. Like just kind of got hit with a curveball right away. And I'm like, I'm scrambling. I'm trying to figure some things out. And I was talking to my wife about it. She said, why don't you go for a walk?
Yeah.
I'm like, good idea. I need to reset. And so I just got up, went for 10-minute walk, and came back. There's a reason that we do that. Yep. Movement, walking, moving our bodies really helps us, to manage some of those feelings that we have, some of those emotions, some of those thoughts, and some of those, mental health activities. Not to mention that when we exercise, our body releases endorphins, which are kind of like natural happy hormones, if you want to think about it that way. So there's this release of endorphins that comes from exercise. Really and truly, you're thinking about, all right, how did God make me to live? And this is the holistic way that I see things. How did God make me to live? Well, the way that we live in modern America is not really the way we were created to live. We weren't created to sit behind a desk all day. We were created to move. Yeah. And that doesn't have to look like 3 hours at the gym. Right. That can look like a walk. That can look like just incorporating it into your day. Yeah. We weren't meant to be so stressed out that, we have this chronic cortisol release, another neurotransmitter, chronic epinephrine release, norepinephrine. This fight or flight system within our body always seems to be activated today. Right. And that's handy when you're like fighting tigers as, a hunter and gatherer.
Mm-hmm.
We need that, but not so handy when the cause of that stress is an email
Right.
or,
Yeah.
you know what I mean? So it's constant today. This stress is constant. That's not the way we were created to live.
Right.
We weren't created to eat junk food and fast food all day.
Mm-hmm.
God gave us fruits, vegetables, and meat. And so I was joking with somebody the other day. I said, there's food, and then there's food products.
Right. Right. Exactly.
The processed stuff being the food products. I'm not sure I call that food. Is it edible? Sure. But,
Right. Right.
um,
Or as Dr. Hyman will say, Mark Hyman, I listen to his
uh,
podcast, he'll say, if God made it, eat it. If
that's
man
right.
made it, leave it.
There you go.
Yeah.
Love that.
Yeah.
100%. I subscribe to that as well too. So, and then I don't want to downplay cognitive behavioral therapy either.
Yeah.
I include that in this non-drug plan because there's a lot of things that therapists are trained, such as yourself, are trained to do
Yeah.
to be able to help people through their problems without needing medication.
Right.
And I see that all the time. And so those are some ways that we can just think about, how did God intend for us to live? Well, think about it that way. He intended us to live in the center of his will. He intended us to eat the things he gave us to eat. He intended for us to move our bodies.
Mm-hmm.
He intended for us to live life in community.
Yes.
We weren't meant to do this alone. And a lot of times our modern world is isolating.
Mm-hmm.
And so being able to have a community of people that you talk to is vital to mental health as well. And, I think all those things can really go a long ways in helping us to, if nothing else, put off the medication choice until I can say, hey, I've tried other things.
Right.
Or build those habits in to where you minimize the amount of medication that you need.
Right, exactly. I think most people who have listened to the podcast will recognize in what you're saying. This is what I've been saying a lot. In most of the episodes, like,
Yeah.
got to pay attention to how much we're sleeping. We got to
Sure.
pay attention to moving our bodies, what we're putting in our mouths. We have to have some kind of social support, and we need to have a connection with God. And when
Hey, look at there.
these things are in place, then that is the foundation that we can build
Foundation.
other things.
Yep.
And I think what Chad and I are trying to express today is that if you have those things in place and there's still something going a little haywire in your chemistry of your body, there are things that can help, and that's okay. That's not anti-Christian to do that. But
And
there's some other steps,
right. And seeing medications as a tool in your toolbox.
Yeah.
It's not the one solution.
Yeah.
But it is a resource that's available should you need it.
Yeah.
I think a lot of times we put too much emphasis on it, and not enough on some of these other options that we're talking about.
Right. And one thing I'll say, particularly with depressed patients, is you should get up and you should go for a walk, and you should make a healthy dinner, and you should call a friend, and you should spend some time in the Word, and those things would help you, but because of your depression, you cannot do those things.
Right.
And I've been a depressed person before, so I know that sometimes it's just hard to peel yourself off the floor.
Yeah, sure.
And so that is one of those cases, I think, when it's really important to have this option of medication, because sometimes it's just the boost that you need to be able to start implementing, like, hey, Anne, I went for a walk today. Great. It's been weeks since you were able to go for a walk, and now you can because you got a little Zoloft in your system or whatever it is, And so that's the place of medication I see. It doesn't have to be, there are some of us who will need it for the rest of our lives just because that's how our brains are wired. But I think for most of the population, it can be a boost that you use for a time to start implementing those lifestyle changes and new habits that are going to make you feel and live a healthy way.
Yeah. It's that push that you need. And you're right. A lot of people are, they tend to be scared of these medications, like, oh, it's going to change my personality. It's not going to have a major effect. You're not going to feel, like you're someone else, but it may give you just that little bit of perk, just enough to get, to give you the ability to be able to do those things that you need to do, but you've been unable to do because of the depression.
Exactly. Yeah. for sure. Um, there's something else I wanted to talk to you about, and I don't think that we will have time in this conversation, but do you mind if we do a bonus at some point to talk about ADHD meds?
Yeah, sure.
Okay.
Yeah. We'll
Well,
get it set up.
everybody stay tuned so we can add that one as well.
Sure.
So, Chad, this has been really helpful and I hope really encouraging to our audience. I want to ask you before you go, what are you doing for soul care?
I have systems in place every day. And I'm just going to tell you, I'm in my Bible
Yep.
and I pray
Mhm.
and I journal.
Good.
I used to be opposed to journaling because I'm like, that's for girls.
Right?
But there's something powerful about getting the thoughts out of here
Yeah.
and putting them down on paper. It closes that loop.
Yep.
If I'm not in the word every day, I know it and I miss it.
Hmm.
If I'm not communing with my creator every day, I know it and I miss it and I'm out of sync.
Yep.
And so those are the things I do each and every day. I have a checklist that I keep to make, I need that.
Yeah.
It keeps me grounded. It keeps me with the right focus with each and every day. But yeah, it's about scripture. It's about prayer, and it's about writing down my to-dos, writing down my thoughts and anything I need to take care of. So.
Yeah. Great. Good to hear it. I'm glad that you're doing the journaling. I too have been opposed to journaling, not because it's for girls, but just because I can't get into the practice of it. But I
Yeah,
can't tell you how many people I've advised to do it because I know it's helpful and
it
people get
is.
a lot of benefit of it. So that's going to be one of my goals at some point to start getting into that practice.
Yeah, for the guys out there listening, you don't have to start it with Dear Diary, I promise.
Right?
But it is super helpful, and it's hey, science proves it too.
Yeah.
So,
Yeah.
lots of helpful things there.
Okay. So how can people find out more about what you're doing? You got the podcast, you got the health coaching. What else do you got going on?
Yeah, sure. A little bit of everything.
Yeah.
The biggest place, you can go to my website. It's www.therevrx.com.
Okay.
My podcast is the RevRx podcast. You can find that on any of your major podcast platforms. And I'm also on social media. You can find me personally, Chad Potts, or you can find me as RevRx Wellness Consulting.
Great.
So any of those places. And then I've got a link too. I want to give your listeners a little freebie.
Good. Yeah, we like freebies.
I wrote a 7-day devotional through the Psalms, and it's really meant to just ignite a devotional habit, just kind of get you into Word every day.
Okay.
And I want to be able to offer that to your listeners too. So I'll make sure you have that link.
Okay.
And
That's great.
yeah, we'll get that out.
So we'll put all those links in the show notes so you don't have to go searching and you'll just click right on through and you'll see Chad's website and socials and all of that and a link to that freebie so you can take a little devotional time in the Psalms there. So thank you so much for offering that to our listeners and for just talking to us about this really important topic today. And I hope that this was encouragement to our listeners. It was fun to talk to you and I really appreciate you.
Yeah, thanks so much. I had a blast. Thanks for having me.
The Soul Grit podcast is a production of Soul Grit Resources. You can find more at soulgritresources.com or on the socials at Soul Grit Resources. You can email me at info@soulgritresources.com.